Arthritis affects nearly 53.2 million U.S. adults, with the CDC estimating that to be about 1 in 5 people. For our class alone, that means 4 of us, 4, will suffer from this painful disorder. Arthritis can be broken down into more than 100 types, with our topic today, osteoarthritis, being the most common form, which affects nearly 32.5 million Americans. My name is Tina Hoff, and we will be discussing the details around osteoarthritis with regard to etiology, epidemiology, pathophysiology, pertinent history questions, expected physical findings, diagnostic testing, complications, and the treatment and management. But first, let's talk about what osteoarthritis is. Osteoarthritis is a disorder that causes breakdown of the articular cartilage over time. If we break the word down, osteo means bone, arthur means joint, and itis means inflammation. So by review, we're looking at a disorder that means inflammation of the bones and joint cartilage. Rogers notes that osteoarthritis is the most common form of age-related joint disease involving the synovial joints themselves. Okay, let's test our knowledge. Osteoarthritis is the breakdown of the articular cartilage over time. True or false? If you guessed true, you got it. Go ahead and shake your dice and move your token, the number on your dice, on your game board, Snakes and Ladders, that you downloaded before the presentation. When one is first diagnosed with osteoarthritis, you might ask yourself, why me? The answer to that question is not simple, and it can actually be a variety of reasons. According to Sen and Harley, some risk factors are age, female gender, obesity, anatomical factors, muscle weakness, and joint injury, whether from work or from sports. There are 2 types of osteoarthritis, primary and secondary. Primary osteoarthritis, or idiopathic, is the most common and is diagnosed in the absence of predisposing trauma or disease and is associated with the previous mentioned risk factors like age, gender, obesity, anatomical factors, and muscle weakness. Now, secondary osteoarthritis occurs as a pre-existing joint abnormality from conditions that include trauma or injury, congenital joint disorders, inflammatory arthritis, and a variety of other things that impact our joints overall. Some of the most common locations of osteoarthritis are the knees, hips, hands, and spine. And let's add on top of this that really only 80% of our patients with OA have radiographic or X-ray evidence of the disease, and 60% of this subset have symptoms. Okay, let's test our knowledge. What is a risk factor for osteoarthritis? Cushing's disease, myocardial infarction, bad karma, or female gender? If you picked female gender, you got it right, so go ahead and shake and move your token. As I mentioned earlier, osteoarthritis affects about 32.5 million Americans, but worldwide it affects 3.3 to 3.6% of the population. This causes a severe disability in about 43 million people. Sen and Hurley also state that it is the 11th most debilitating disease worldwide. Not to mention, it is the second most expensive disease in the United States. In 2011, there were nearly 1 million hospitalizations for osteoarthritis with a cost of almost $15 billion. As noted earlier, not all of our patients will have that radiographic evidence of the disease, adding to the complications of the management. Let's take a look at the further breakdown of prevalence by age, gender, and ethnicity. According to Osteoarthritis Action Alliance, 43% of people are 65 years of age or older, and 88% of people are 45 years of age or older. 62% are women, and 78% are non-Hispanic blacks. If you are younger than age 45, typically osteoarthritis is more common in men, And the annual incidence of osteoarthritis in the knee is the highest between 55 and 64 years of age. All right, we're coming back to testing your knowledge. The two types of osteoarthritis are Cheech and Chong, primary and secondary, hypo and hyper osteoarthritis, or type 1 and type 2. If you picked B, primary and secondary, you have got another opportunity to roll your dice and move your guy. Osteoarthritis is a disease that affects the entire joint, leaving absolutely no tissue behind. How kind, right? Early disease damage is marked by chondrocyte damage through an increased expression of degradative enzymes. The increase in these enzymes lead to the destruction of the collagen matrix and, over time, cell apoptosis. This causes the cartilage to get softer, weaker, and to continuously lose elasticity, which causes it to flake off into the joint space, also called joint mice. At this point, the type A cells of the synovium attempt to remove the joint mice, which triggers pro-inflammatory markers and proteases to mediate joint destruction. Cartilage then continues to erode away until the bone is exposed, allowing it to rub with the other bone. This causes the bone to grow outward, which makes the joint look wider. Clinical manifestations consist of a triad of symptoms of joint pain, which are deep and achy that worsen with use, morning stiffness, and motor restriction. In addition, you can also experience muscle weakness, crepitus, balance issues, and hypertrophic changes to the joints. Here's another test your knowledge. Osteoarthritis develops due to the deterioration of the synovium within the joint that leads to complete bone fusion. True or false? If you selected false, you get to roll the dice and move forward. Next up are the pertinent history questions, and of course the staple that we have is old carts. We also want to make sure that we're getting the past medical history, family history, social history, and surgical history. Some pertinent questions that may apply is: how long have you had symptoms? Are your joints stiff in the morning, and if so, for how long? Has there been any injury to the area? Now we're going to test our knowledge, and we're going to look at the questions that apply to osteoarthritis and select all that are applicable. When was your last bowel movement? Are your joints stiff in the AM? Has there been any recent or past injury? And how many children do you have? If you selected B and C, you get to move forward. A thorough history and focused musculoskeletal physical exam must be performed on a patient that you suspect with osteoarthritis. This diagnosis can usually be made clinically with enough confidence if there's pain worse with activity and better with rest, age is greater than 45, morning stiffness that lasts more than 30 minutes, bony enlargements, Herbert's nodes, or Bouchard's nodes. Just note the location of these nodes on the fingers, and there's range of motion limitations. Some differentials can be noted in the presentation, but I do want to go through and do another test your knowledge. When you're doing a head-to-toe assessment, you note the bony outgrowths on the distal interphalangeal joint. You document these findings as what? So if you picked Herbert's nodes, you got it right and can go ahead, roll your dice. All right, everybody, rounding down to the end, I guarantee you, hang on for just a little bit longer. We're going to be talking about diagnostic labs and testing. So some serum labs we can order is a CBC, an ESR, rheumatoid factor ANA, all of which are going to be normal in osteoarthritis. Arthrocentesis can be also performed by a physician under sterile technique. We're going to be looking at x-rays of the affected joint, CT scans, MRIs, and possibly doing a procedure of arthroscopy by the orthopedic surgeon. But we're going to haul into, again, testing your knowledge. So if you receive your patient back from radiology and the patient has an x-ray of the hips and knees for evaluation of possible osteoarthritis, what are the findings that would appear on the x-ray if OA was present? Select all that apply. And if you picked B and C, you got it right. Go ahead and shake that dice. As with anything, complications can arise from disorders. Complications that come from osteoarthritis are pain, falls, difficulty ambulation, joint malalignment, decreased range of motion, radiculopathies, diminished mood, and weight gain. Some of the important things with regards to treatment is to make sure that we're treating the patient as their own. Some non-pharmacological interventions include avoidance of activities that exacerbate the pain and overload the joint, exercise, tai chi, weight loss, occupational therapy, and braces or orthotics. Some pharmacological treatment options are oral medications, topical medications, and interjoint injections. We want to make sure that we have the people on our team who are consistent with those that can help. We want to look at a dietitian, physical therapy, occupational therapy, rheumatology, psychology if necessary, and consulting with a pharmacist and orthopedics would be helpful. All right, last couple, test your knowledge. A patient with osteoarthritis has finished their first physical therapy session. As a nurse, you want to evaluate the patient's understanding of the type of exercises they should be performing regularly at home as self-management. Select all of the exercises that should apply. Excellent. If you selected B, C, and E, you can roll the dice. The last test your knowledge is here. A patient newly diagnosed with osteoarthritis asks about the medication treatments for their condition. Which medication is not typically prescribed for osteoarthritis? If you selected C, you got it, and you can roll again. Let's talk about summary. Osteoarthritis is a disorder that causes the breakdown of articular cartilage over time and causes joint pain that worsens with use. It is characterized by a triad of symptoms of joint pain that worsen with use, has morning stiffness, and has motor restriction. The goal of treatment is to minimize the pain and the loss of function. Most important pieces are being exercise and weight management. It's important to remember that each patient deserves individualized treatment. These are my reference, and I want to thank you for watching my video.